Let's answer some scope of competence and some scope of practice questions. So here's the thing. When it comes to these questions, it can get kind of like overlapping with each other, but that's a good thing because you can't have one without the other, right? So the thing about it is scope of competence is your personal, it's you personally. You know who you can and who you cannot work with or who you can treat, right? Practice is legal. It's the legality of it all. You know what legally you are allowed and what you should not be doing, okay? So we are going to treat these questions as if we are taking the MFT National Exam. Feel free to pause the video, see if you can come up with the answer on your own before I reveal the answer to everyone, right? So the first one, a couple is seeking therapy due to one partner's recent diagnosis of schizophrenia. The MFT has no experience working with severe mental illness. What should the therapist do? So remember, what did I just say? Competence is personal. You know who you can and cannot work with. You know what it is that you need to do in order to find the best support when you are working with that family, that couple, or that client, right? So A says refer the client to a psychologist and discontinue services. Now remember, we are treating this question that if we are taking the MFT National Exam, right? B says continue working with the couple on relational issues while consulting with a therapist. C says continue treatment and research schizophrenia independently. And D says conduct therapy with a focus on the individual with the diagnosis or whatever the case may be, right? Okay, so let's take a look at them. Go back up to the question. We don't have any experience working with severe mental illness. So if we don't have any experience, what do we need to do? B, A says to refer. That's a bit much. It's a bit much. You don't just have to refer out to a psychologist and discontinue services. But what about B? Continue working with the couple on relational, because we can work on relational issues, but we need to consult with a specialist. We have to consult to make sure that we are doing no harm. C says continue treatment and research schizophrenia independently. Absolutely not. You've never worked with a severe mental illness before, and independently working on your own tells me that you don't have the education, you don't have the training, so you need to consult. That's not going to be good enough with you working independently. It's best for you to consult and get the best support that you need in order to do no harm to the client. Okay? All right. During therapy, a 15-year-old client discloses that an adult family friend has been sending them sexually explicit messages. What is the therapist's legal obligation? Okay, we're treating this question as if we're taking the exam. What is the therapist's legal obligation? This is a legal question. A says to maintain confidentiality unless the client agrees to disclose. Report the incident to Child Protective Services. Encourage the client to block the center and monitor the situation, or inform the parents and allow them to decide on reporting. We are mandated reporters. It is our ethical and legal duty to make sure we do what when it comes to our clients, right? Make sure that they're safe. Our client welfare is important. A says maintain confidentiality. How? You've just been told that a 15-year-old is receiving sexually explicit messages from a family friend. The kid is 15 years old. C says encourage the client to block the center. Okay, we'll do that. He can definitely do that, right? Inform the parents and allow them to decide. No, we make the decision. We were already making a decision because B says report it. And that's what we're going to do. That is our legal obligation. There's text messages showing that a kid is receiving sexually explicit messages from an adult family friend. The red flag is the sexually explicit messages that we cannot ignore. Right? Yes, we can encourage them to block the sender, but not before we make a mandated report. A new client reports persistent low energy, difficulty sleeping, and feeling physically drained for the past several weeks. The therapist notes that these symptoms may indicate depression, but the client has not seen a doctor in years. What should the therapist do first? Now, again, we're taking the exam like right now. Pause this video, look at this question, because remember, we are not doctors. We are MFTs, we are therapists, but we are not doctors. And there's some stuff that's going on in this vignette, right? There's some stuff that's going on in here that we can't treat, that we can't do anything about. right? A says start cognitive behavior therapy. Oh my God. Yeah, right, because this person has low energy, difficulty sleeping, and the last thing they want to do is start cognitive behavior therapy, right? C says advise the client to wait and see if the symptoms is going to improve. Now, let me stop you right there. We don't give advice. We don't give advice and we don't give opinions. That advice is ridiculous. Wait and see if the symptoms improve. Okay, D says prescribe. I don't know how we're going to prescribe the medication. How? We don't have a script. How are we going to prescribe the medication? Making D incorrect, right? B says recommend the client see a medical doctor for a physical health evaluation. That is the next best thing that we need to do, because we're not doctors, right? And we don't pretend to be doctors. During the session, a client tells their marriage and family therapist that their depressive symptoms have worsened and asks whether they should adjust the dosage of their antidepressant. What is the therapist's most appropriate response? Now, pause the video, look at this question, and make it make sense. We are not doctors. Keep that in mind. A says suggest the client speak with a prescribing provider. Okay, sounds nice. B says recommend gradually increasing. There it is again. We don't give recommendations for medication. We don't advise on medications, and we don't give opinions when it comes to medication. Because if we did, then we would be a psychiatrist or a doctor. But we didn't go to school for that, right? C says encourage the client to discontinue. Now you telling the client not to take the medication, which is the same as what B. D says schedule additional therapy sessions. What is that going to do? That's not what the client asked you. The client is asking if they should adjust the dosage of the antidepressant. D says it have absolutely nothing to do with what the client is asking. So your response needs to be go back and see your doctor. Or go back and see that psychiatrist, right? We are not doctors. Keep that in mind. Please don't be out here giving these clients advice on medication. A couple from a cultural background unfamiliar to the therapist begins therapy. The therapist realizes they don't understand key cultural norms relevant to the client's conflict. What should the therapist do? Pause the video, look at the answer responses. We are taking the national exam as we're looking at these questions, right? The therapist realizes they don't understand key cultural norms relevant to the couple's conflict. So what should we do? A says refer the couple to a therapist from their cultural background. B says continue therapy while gaining cultural knowledge and consulting as needed. C says ask the couple to educate the therapist about their cultural norms. And D says tell the couple cultural issues should not affect therapy goals. Okay, there it is right there. D is hilarious. Tell the couple cultural issues should not affect therapy goals, for the love of God. No, we're not doing that, right? And we definitely not doing C. We don't ask our clients to teach us. We're not asking our clients to educate us about cultural norms. That's your job, right? A says refer the couple. We don't have to do that. That's a bit much. When all we have to do is consult as needed and gain the cultural knowledge. You see? There's a pattern to these questions, right? A pre-licensed MFT associate has a client with complex trauma and dissociative symptoms. The associate feels unprepared to manage the case but wants to help. What is the best step? So here it is again. You know what you can and cannot treat. You know which clients, which families, which individuals you can and you cannot work with when it comes to your knowledge. Competence is up to you. It is up to you to stay competent. A says terminate with the client and report to the board. B says continue therapy but reduce session frequency. C says bring the case to supervision and discuss competence and potential referral. D says research dissociation and try exposure therapy. So now D is making it seem like you're experimenting with this client, and we don't experiment with clients because then what? We could possibly doing them harm. C says bring the case to supervision. Okay, I like how that sounds. But then look at B, continue therapy but reduce session frequency. Now the client has to be hurt by not coming to therapy because you don't want to do what it is you need to do in order to stay competent while working with them. A is abandonment, and why are you reporting to the board? You think the board want to hear that you don't know how to work with complex trauma? No, don't be wasting their time with that. But if you do C, bring the case to supervision and discuss competence and a potential referral, that makes more sense. That shows that you are doing your best practices, doing what you need to do in order to help the client that is there, right? Okay, an MFT becomes interested in using IFS with clients. They've read several books and attended a 1-day workshop. What is the therapist's best course of action before using IFS with clients? Begin applying IFS with current clients on a trial basis. Use IFS only with clients who consent in writing to the new approach. Complete formal training and receive consultation before implementation. Or D, integrate IFS as a secondary approach to avoid ethical issues. D is bonkers. A secondary approach. Okay, whatever. B says use IFS only with clients who consent. They sign the informed consent, but do they know what they're signing, right? A says begin applying with current clients on a trial basis. So again, now you send here experimenting with the clients with a new approach, and you can't do that, right? C, look at C, complete formal training and receive consultation before implementation. That sounds so much better. You've only taken a 1-day workshop, right? And you've read several books, but you want to be sure that you know exactly what you're doing before you start using it with other clients, okay? An MFT who provides individual therapy is subpoenaed to testify in a custody case about a client's parenting abilities. The therapist has no forensic training. What is the most ethical response? We are treating this question as if we are taking an MFT National Exam. Pause the video. Look at the question, see if you can come up with the best answer. The therapist has no forensic training. A says comply fully and provide expert testimony with no experience. Keep that in mind. C says attend court but limit testimony to factual observations within scope with no experience. I will say that. D says submit a written report recommending custody arrangement with no experience. Right? With no experience. B says decline to testify because it breaches confidentiality with no experience. So we have to keep that in mind. Every answer response, keep it in mind that you have no experience, right? We can't comply fully because we don't have any experience. It does not breach confidentiality, so B would be out. D says submit a written report recommending custody arrangements. No, we cannot do that, right? We can't. C says attend court but limit testimony to factual observations within your scope. That is the correct answer because it puts you within the scope of what you know, what you can and cannot do. So as sure as enough as I took that question with no forensic training, keep that in mind when you are looking for your best response. Okay. Alrighty. A client is experiencing both relational distress and active opioid use. The MFT has no training in substance use treatment. What is the most appropriate course of action? A says, and pause the video if you feel like you need to. We're treating this question as if we are taking the MFT National Exam where we are using our correct thought processing, okay? A says begin couples therapy immediately while addressing substance use as a minor concern with no training in substance use treatment. You're going to do A. B says refer the client to a substance use specialist and suspend therapy because you don't have any substance use treatment experience. Continue working with the client on relationships and coordinate care with an addiction counselor because you have no substance use treatment experience. D says encourage the client to quit using opioids before starting because you have no substance use treatment experience, okay? They're experiencing both relational distress, so now we got some dual issues that are going on with an opioid use, issue. No training in substance use treatment. What is going to be our best response here, right? You can't do A, addressing substance use with a minor concern. You can't do A, you have no experience in substance use treatment, right? B says refer the client to a substance use specialist and suspend therapy. Why do we need to suspend therapy? Because they already having relational distress. You can't just suspend therapy. Now you're abandoning them and getting rid of them, and they need your support. But if you look at C, continue working with the client on the relationships and coordinate care with an addictions counselor because you don't have substance use treatment experience. All these questions are kind of like, there's a pattern to them. They run the same. Like I said, each and every one of us, we know our scope of competence. You know what you can and what you cannot work with. You know which clients, which families, which individuals that you have experience with using certain models or certain issues that this client, this family, or these individuals might present with. You know what you can and cannot do. I can't tell you that. It's not about the law. It's about you personally, what you have training in and expertise in, right? For the past 10 years, I have been working with a lot of my teenagers and my adolescents with trauma. I have 10 years experience in that. I have certifications in that. That is where I'm competent at. I have never used internal family systems model to know it. I've studied it in school. I remember in school, this was years ago, but if I wanted to use IFS with my clients, how can I do that if I don't know how to at least, use this model in full, right? There are certifications that you can get in IFS, and if you want to use IFS, then go that route, right? I have worked with personality disorders for the past 10 years. Schizophrenia, I've worked with mood disorders, bipolar, borderline personality disorder. I've worked with those for the past 10 years. I have experience in it. I have took CEUs for them. I have that experience. I've never worked with eating disorders before. I've never had a client with an eating disorder before. So I know for a fact, how would I be able to help a client with an eating disorder if I've never worked with one? I wouldn't feel comfortable working with a client with an eating disorder. I've never worked with them before. Your competence is personally what you know how to do. I can't tell you what you can or cannot do. Nobody else can. You know what you can personally do, right? That's how you need to look at it when it comes to these questions. I hope this makes sense. I hope this video is able to help you find the difference between your scope of competence and your scope of practice when it comes to you working with your clients, your families, or these individuals. I am around today. Send me a message, ask me a question, leave me a comment. I will be sure to respond. I will talk to you all soon.